You are listening to PR Radio Station of America.
When President Donald Trump raised concerns about acetaminophen during pregnancy, many women immediately felt uncertainty. His claim that the drug might be linked to autism struck a nerve because acetaminophen, widely known under the brand Tylenol, is often the only pain reliever recommended during pregnancy. His advice that women should tough it out if they had pain or mild fever added to the confusion. Doctors quickly began receiving phone calls and emails. Dr. Heidi Leftwich at UMass Memorial Health noted a noticeable increase in questions from expectant mothers. For her patients, this was not a casual remark. It directly affected choices about their health and their baby's safety. At Mass General Brigham, Dr. Allison Bryant explained that these flare-ups of concern happen regularly whenever acetaminophen appears in the headlines. She pointed out that the drug has been in use for decades, yet worries resurface every few years due to political statements, news articles, or partial studies. The Food and Drug Administration added to the unease by issuing a letter urging doctors to consider minimizing acetaminophen use for routine low fevers. While the letter did not ban the drug, the timing created the impression that medical consensus was shifting. Families across the country interpreted this as a warning, even though official guidance remained unchanged. For many pregnant women, the sudden mix of presidential remarks and regulatory letters created unnecessary fear. Doctors emphasized that this anxiety was avoidable and stressed that decisions about pregnancy health should be based on science, not politics. Despite the noise from Washington, medical professionals have continued to reassure patients that acetaminophen is safe when used as directed. They stress that their guidance has not changed and that the drug remains the primary choice for treating fever and pain in pregnancy. Dr. Laura Riley of Weill Cornell Medicine described how patients arrived at appointments visibly anxious, asking if they should stop taking Tylenol. She explained that her message was consistent. Acetaminophen, taken carefully, protects both mother and child from the risks of untreated fever. High fevers can be dangerous, especially early in pregnancy. In the first trimester, elevated body temperature raises the chance of miscarriage, premature birth, or certain birth defects. Later in pregnancy, fever can trigger contractions and early labor. Because of these risks, doctors insist that it is better to treat fever promptly than to leave it unchecked. Professional organizations, including the American College of Obstetrics and Gynecology, continue to recommend acetaminophen. Their position rests on decades of data, including a study of 2.4 million children published in JAMA. That research showed no connection between acetaminophen use during pregnancy and autism, ADHD, or intellectual disability. For doctors, the conclusion is straightforward. The dangers of untreated fever outweigh the hypothetical risks promoted in political speeches. Responsible use of acetaminophen remains a cornerstone of safe pregnancy care. Personal stories bring clarity to the debate. Emily Human, a 31-year-old in Florida, became seriously ill during her first trimester. A viral infection spiked her temperature to 104 degrees, creating a potentially life-threatening situation for both her and her unborn child. Her doctor's instructions were clear: take acetaminophen immediately. Within an hour, Emily's temperature dropped, lowering the risk of complications. She later reflected that without the medication, the fever might have harmed her pregnancy in ways she could not imagine. Another woman, Katie Wook from Illinois, struggled with severe migraines during her pregnancy. Family members pressured her to avoid all medications, telling her she would hurt the baby. She listened instead to her doctor, who explained that acetaminophen was safe. The decision gave her relief and allowed her to function normally during the early months of pregnancy. Doctors say these real-life examples highlight why scaring women away from medication can be dangerous. Untreated pain and fever not only cause suffering, but can also lead to anxiety, depression, and high blood pressure, all of which create risks for pregnancy outcomes. The experiences of Emily and Katie underline a simple point: trust in medical guidance matters. Listening to science rather than political statements can make the difference between a safe pregnancy and avoidable harm. Physicians remind patients that while acetaminophen is safe, responsible use is key. The guiding principle is to take the lowest effective dose for the shortest necessary time. This ensures the benefits are achieved without unnecessary exposure. Dr. Heidi Leftwich emphasizes that the same advice applies to nearly all medications. No drug is meant to be taken without caution, but acetaminophen remains one of the safest options available when guidance is followed. Shared decision-making is another critical part of care. Rather than dictating strict rules, doctors like Alison Bryant involve patients in open discussions. This builds trust and gives expectant mothers confidence that their choices are informed and respected. Experts also note the global context. More than half of pregnant women worldwide use acetaminophen. It is included in hundreds of over-the-counter cold and flu treatments. If serious risks were present, they would have been detected in decades of widespread use. By balancing caution with care, doctors reassure women that they can treat pain and fever safely, protect their babies, and avoid unnecessary fear. The message is clear: used wisely, acetaminophen remains the right choice. After the political debate, the most important task for doctors and advocates has been correcting misinformation. They stress that while research continues, the strongest evidence available does not show a link between acetaminophen and autism. Doctors caution that frightening pregnant women away from medication can have real consequences. Refusing treatment for high fever can harm both mother and baby, while untreated pain can damage mental health and increase medical risks. Emily Heumann, now nearing the end of her pregnancy, expressed gratitude that her doctor encouraged her to use Tylenol during her illness. She credits the medication with not only lowering her fever, but also easing the intense throat and ear pain from her infection. Pregnant women already carry heavy burdens of responsibility, fear, and guilt. Adding unfounded worries about one of the few safe medications available only increases stress. Experts insist that decisions about care should remain grounded in science, not speculation. The lasting message is simple: acetaminophen is safe when used carefully. Pregnant women should trust their doctors, take the lowest dose for the shortest time, and remember that untreated fever or pain can be more dangerous than the medication itself. This is the end of that story. Now tell me in the comments, what's your story? I'll read out the most interesting ones in the next video. Do not forget to hit a like button and subscribe. See you.